Magandang umaga po sa lahat at maraming salamat po sa PIDSP sa inyong imbitasyon na makisalimuha kayo ngayong umaga. Thank you PIDSP for this kind invitation to be with all of you today. Doc Sally, Dr. Mary Ann Bunyi, and of course my greetings to PPS President Dr. Mila Bautista. Tawag po sa akin Suki. Suki na ako dito no? And some say, kung kayo frequent flyer, no, mabuhay miles or something, no, pwede siguro frequent speaker, kulang na lang card. But better still siguro na lang, Doc Sally, adoption papers. Para talagang suking, hindi lang suki, more than that. But it's a pleasure to be with all of you today. And it's surprising you're still not tired of the warm stories that I've told you for the past so many years. But there are updates, and I hope there will be some take-home messages after this short discussion with you. And so let's begin. We talk about neglected tropical diseases. They are the infectious diseases of poverty. Most of these neglected tropical diseases, and they are 17 listed under the what we call the neglected tropical disease unit of the World Health Organization. Most of these diseases are parasitic infections. A lot of these infections are related with poverty. And so remember the first take-home message, PPP, people, parasites, and poverty, they go together. PPP. They affect more than 1 billion people, mostly in the poorest communities. And of course, these are ancient diseases. No? Since time immemorial, they have plagued humanity. They cost developing economies billions of dollars every year in terms of lost opportunities. And one of the best news I have for you today is that the neglected tropical diseases are now listed as one of the priorities under the Sustainable Development Goals. So you must be familiar with MDGs, Millennium Development Goals. We've ended our quest for the MDGs in December 2015. From 2016 onwards to 2030, nandito pa kaya tayo, Doc Sally, ng 2030, we are aiming to achieve what we call the Sustainable Development Goals. And for the first time, the United Nations talks about neglected tropical diseases as one of the priorities. The costs of NTDs may actually permanently worsen the family's economic status. And in fact, in the Philippines, there is evidence that shows the presence of more neglected tropical diseases in Philippine provinces over the last 5 years, associated with higher incidence of income poverty. So there is evidence that NTDs are closely linked with poverty even in the Philippines. This, according to the Philippine Human Development Network, which are actually composed of a group of economists. No? And as part of an international network of economists very interested now in health and development. So here is the listing, and probably memories will come, memories related to your stint in microbiology and parasitology. Note that most of these are actually parasitic, helminths and protozoans. There are 13 out of the 17 endemic in the ASEAN region, which most recently has become unified as an integrated or one ASEAN. The numbers are hard to neglect because the numbers are quite significant. Top-notcher among all is this entity called soil-transmitted helminths, which will be the subject of our short discussion this morning. Just a short note on the second to the last, schistosomiasis. We used to be the first runner-up in terms of schisto, with actually the champion being China. China has done an excellent job with controlling schistosomiasis japonicum. And so what happens when Miss Universe is no longer able to continue her reign, the first runner-up becomes Miss Universe. And now the Philippines now is number 1 for schistosomiasis japonicum. And so we focus on the most common worms. I'm sure you see patients every day, probably not in your clinics, the street children, the children you see in the public schools. I'm almost sure that you see them every day, these infected children with common worms. For as long as there is continuing open defecations, these worms are going to keep on coming back. Sila'y umalis, sila'y babalik, at sila'y dadating because of continuing open defecation. The experts have listed the top populations at risk, and these are namely preschool-age children, ages 1 to 5, school-age children 5 to 14, women of childbearing age. And what is the concern about women of childbearing age? Especially adolescents and young females who are menstruating, infected with hookworm and or trichuris will actually result in more anemia. And now there is a trend for these young females getting pregnant. We have a growing problem with teenage pregnancy, which is also a concern of pediatricians. And we are very concerned if there are worms competing, with the mother and the child. And of course, higher high-risk populations. The figures, as in terms of morbidities, are also difficult to ignore. The Philippines, in fact, is one of the top 10 now in terms of prevalence of stunting. And this, I think, should be the concern of all of us. Stunting to the tune of 30% prevalence among children less than 10 years old. Anemia, 39%, quite a high figure in the modern day and age. Note poor cognitive development and school performance resulting from these worm infections. And lastly, just to talk a little about heavy-intensity infections, which I will mention in the next 1 or 2 slides. Heavy-intensity infections mean actually heavy worm burden, and there are estimates that show a child with Ascaris heavy-intensity infection is passing out 10 million eggs per day. Can you imagine 10 million eggs, not in a week, or 10 million eggs, not in a month? It's 10 million eggs per day. And compute the number of days a heavily infected child is not treated. That is the amount of eggs, the number of eggs actually that could be passed out in the environment. Hence, a need really to look for the heavy intensity infected children and get them subjected to our mass drug administration. What is the situation in the Philippines? We've gone quite a long way. Baseline figures provided by the University of the Philippines to the Department of Health showed something like 7 out of 10. I have shared that with you some years ago. 7 out of 10, that's very high. Anything above 50% is very, very high. Note that in the recent years, continuing sentinel surveys done by the University of the Philippines show roughly about 4 out of 10 children infected, both in school age and preschool age children. Note that there is additional data now on adolescent females, again a concern of pediatricians, where infection rates are actually not low. It's about 30%, and among women of childbearing age, pregnant women, it's also as high as 31%. The current standard, as far as WHO is concerned, is that anything above 20% is high. In the Philippines, we're still at 50. I said, let's bring it down to 20. Let's have the global standard now applied to the Philippines, where 50% is no longer acceptable. WHO targets prevalence of less than 20%, and heavy intensity infections, ito yung mga 10 million eggs per day, dapat less than 1%. And we have a long way to go. Take a look at this. Preschool age children, 10 million eggs per day, still 22%. Among school-age children, it's about 20%. Heavy-intensity infection, 8%. And so with pregnant women, still at 10%. So we're failing in terms of not meeting the target for heavy-intensity infection. There are extremes. Some examples, there may be some Ilongga pediatricians in the audience. Soil-transmitted helminths in Negros Occidental, pretty high. Still at 68 and 61%. Very, very high intensity of infections, 45%, 10 million eggs per day. Grabe. No, talagang, these heavy intensity infections don't happen overnight. Heavy intensity infections speak of a lack of coverage in terms of deworming, with more and more eggs coming in, with more infections actually coming on top of existing infections. And it happens over a period of time, like a few years, before a child gets to be heavily infected. It's the same story in Leyte, also an extreme, with adolescent females infected to the tune of 60%, and that's a few years old. This data is just a few years old. Heavy intensity infection up to 23%. Pregnant women, a staggering 76%. That's very high. 3 out of 4 pregnant women infected with worms. And heavy intensity infection in Leyte to the tune of 40%. These are pre-Typhoon Haiyan or pre-Typhoon Yolanda figures. And so you might ask, what happened after Yolanda came? So one of two things. Number one, the patients who are infected may have died, and also the worms would have died with the people where they live. And number two, these people are still around. And in fact, one of the things we had suggested was to catch the people in the evacuation centers and do deworming there, because they are actually captive already. Not sure if it was followed at that time. But at that time, of course, I was still not with the Department of Health. Leyte is also quite memorable because in Leyte, they have been added, not bonus, it's an added burden of this problem called schistosomiasis. Now, in school, we learned about Leyte and Samar and schistosomiasis intertwined with each other. Schisto is still one of the big issues in the Philippines. I remember the Archbishop of Palo. Now, the current Archbishop is Archbishop John Du. He complains to me, "Doctor, please help us." And I said, "How can I help you? More than 50% of my priests have schisto, and more than 50% of my seminarians have schisto." And I said, "Bishop, how did you know that your priests and seminarians had schisto?" "Doctor, our seminary is just in front of the schisto hospital." And so they just had diagnosis across the highway because that was the DOH schisto hospital. So on our way back to the hotel, which was destroyed by Typhoon Yolanda, that hotel called Hotel Oriental, now I asked the DOH driver, "Can you show me this place where this seminary and the Schisto Hospital exist?" And the driver said, "Doc, we call that place SSS." I said, "What does SSS stand for, Doc?" "The seminary is in front of the Schisto Hospital, and that behind the Schisto Hospital is a cemetery." So it's really SSS. And of course, when people got to that hospital, it's far advanced schisto. And you will still see there, up to this time, cases of cerebral schisto. Sometimes I talk to doctors, "Uso pa ba yan?" "By uso, you go to Samar and Leyte, you will see lots of them there." Oh, another extreme. One of the latest, in fact, this is still up for publication. This is now submitted for publication. Masbate, one of the poorest provinces in the Philippines. And incidentally, the governor now is incarcerated, no, because of the PDAF. No? Masbate, 2015, STH, in the modern day and age, 72% is not acceptable. No? It's the baseline for the Philippines in 2006. That's almost 10 years ago. Look at this. In 3 barangays, it was 100%, a perfect score. 100% of children in the daycare centers infected with worms. So hindi pa tumutungtong sa kinder at grade 1, talo na. In Bisaya, pildi na. No? Talo na. Now, very interesting. That NGO called ACF declares 7 barangays open defecation free. So there is a declaration, open defecation free. Infection rates more than 50%. How true is it that that place is open defecation free? Remember, these worms are coming from people. Stop blaming the animals. The animals have something else. No? It's people really infecting people, and thanks to open defecation. So, ano solusyon? Well, you've heard about this in your preventive and community medicine. You've heard about this in parasitology, water, sanitation, hygiene, deworming. We can keep on talking and talking about water and sanitation, hygiene, but a lot of these things are actually easier said than done. What can we do? Physicians, pediatricians, public health workers, let's focus on deworming. But there is now a new strategy that number one strategy listed here is called preventive chemotherapy. It is not for cancer. No? Just an interesting story, one pediatrician approaches me and asks me, June, pwede bang palitan ng pangalan ng preventive chemotherapy? Sabi ko, bakit? Kasi yung chemotherapy pang cancer. Sabi ko, hindi ako nag-imbento niyan. It was invented by WHO. No, preventive chemotherapy is a standard terminology. I will discuss that a little more in the next slide. But this is the package now of interventions recommended by the WHO to actually win this battle against the neglected tropical diseases. There's going to be a need to actually interact very closely with vector experts and veterinary public health, because without doing so means we keep on dealing with these other neglected diseases like schistosomiasis forever and ever. Huwag kayo mag-amen, no? Kasi pwede pa namang maremedyohan. Okay? Schisto, incidentally, is one parasite that heavily exists also in animals. The cats, the dogs, the pigs, the rodents, the carabaos there in Samar Leyte, they carry also schisto. And so physicians stop playing around with the animals. No, we are not experts in the animals. It has to be led by the vets. No? And for as long as we are not having the vets on board, we are still not near schisto elimination. So let's talk about preventive chemotherapy. The use of anthelmintics either alone or in combination for morbidity control. It is not for eradication or elimination. It is to minimize, if not eliminate, morbidity. Mass drug administration is actually the synonym for preventive chemotherapy. It is deworming in an eligible population even without the benefit of diagnostic examination. I hope there's no more pediatrician that stops mass treatment that goes on in the schools because the children have not been examined. Evidence says that actually more than 50% qualifies these high-risk areas to receive biannual deworming. The target coverage for mass treatment or mass drug administration is 75%. The DOH is a little more ambitious at 85%. Good news, there is now a harmonized schedule for biannual deworming for both preschool and school-age children in the Philippines. This comes every January and July. So that is going to be now the 2 months called as part of the deworming season, no, January and July. It used to be 4 months. Preschool, April, October. School age, January, July. Nalilito ang mga local government units. So we have simplified it in such a way it's easy to remember. Remember JJ, January, July. Okay? Of course, you know a lot about these deworming tablets. The top 2 ones, albendazole, mebendazole, broad spectrum. Kanina, Doc Sally was talking about narrow spectrum antibiotics. For anthelmintics in a country like the Philippines, we want broad spectrum anthelmintics because multiple infections is the rule. I remember when we were doing some surveillance there in Agusan del Sur, for those of you working in Mindanao, we had medtechs lined up there, in one of the barangay schools, stools collected from children, and they would say, positive ascaris. We have a quick count, like Comelec, quick count, how many percent, at the end of the day, how many percent of children infected? So the medtech will say, positive ascaris, positive hookworm, positive trichuris, positive schisto, positive heterophid. Heterophid is a fish-borne parasite you get by eating kinilaw. Okay? And it manifests itself as peptic ulcer-like symptoms. Okay? So pag 5, ascaris, trichuris, hookworm, schisto, heterophid, I say, bingo! 5 types of worms in one child. Terrible. That's why we want a broad spectrum anthelmintic. Remember that the helminths are immobilized through inhibitory effect on tubulin polymerization. It's nothing but paralysis, immobilization. And I know there are pediatricians who prescribe anthelmintics plus antihistamine, diphenhydramine. No, I'm lucky, Dr. Sally, who was my teacher, I'm very proud to say Doc Sally is my teacher. But she just graduated then when she was my teacher. They never taught us to give antihistamines with anthelmintics because nowhere will you see any guideline, any evidence that says when you give antihistamine, it is good with deworming. But I investigated this a little bit. I interviewed some pediatricians, some of them very senior. They're in Central Visayas and Western Visayas. So I did a short survey. Doctora, why do you give antihistamines? So one pediatrician said, oh, I want to put the worms to sleep. And of course, I did not answer back. No? In my mind, I was about to ask her, does the worm suffer from insomnia that you want to put the worm to sleep? The other pediatrician said, I want to sedate the worm. Sedation of the worm. You need a psychiatrist here. No, does the worm suffer from anxiety or depression that it needs sedation? But this is the thing that happens. No, certain schools promote the use of antihistamines. And the last point I want to say is this. I will pose a question to you, ladies and gentlemen. You're the experts in pediatrics. Why do you want an already immobilized worm to be put to sleep? Or why do you want an already immobilized worm sedated? So maybe, and imagine the scenario. The worm is awake and is already immobilized. That's why sometimes the worm comes out. It is moving a little bit. And it scares the hell out of health workers sometimes. No? So imagine the scenario where the worm is awake but is already immobilized. You still put the worm to sleep. No? Isn't there a thing called cruelty to animals? All right, adverse event. Let's talk about adverse events. And sometimes doctors are so afraid of adverse events. But we got training to deal with adverse events. Even paracetamol has adverse events. Adverse events, the experts say, related with deworming, may be a sign that the drug is taking effect. The more worms, the more side effects, and the more severe adverse events. That's why the first time we ever did mass drug administration in one school of 2,500 children, lots and lots of them experienced adverse events. Some moderate, a few severe. No? But of course, nothing serious to get them hospitalized. Okay? So, in other words, expect that. If there are no more adverse events after deworming, maybe we're closer to being worm-free as a nation. But while we see adverse events, that means we're still far from being worm-free. Adverse events. Okay, the benefits are quite clear in terms of physical growth, learning and education, and the long-term benefits, and other ancillary benefits in terms of reduced burden of TB and malaria. And so the evidence is we must do preventive chemotherapy. Good news, the Department of Health is buying all the deworming tablets needed by the whole Philippines for all preschool and school-age children. There's no more shortage of funds or drugs for worm control in this country. Let's make use of them well. Not so good news, not very high coverage rates. No? And really, the issue here is a lack of health promotion, health communications, risk communications. Now, sometimes it's more than the physicians that need to do the job. There are experts in health communications we probably will need to tap. Cambodia and Laos are beating us. Take a look at that. They have very good coverage rates. Philippines, take a look at that. 2014, school-age children, it was a measly 16%, which is very, very low. Here are the reasons for refusal. And again, this should be the target for health promotion. The Department of Education requires a parent's permit. One reason, parents cite, they don't want their children to be dewormed because the child now has been dewormed. When? Last year. As early as 3 months after deworming, the worms are already back because of problems related to wash. Then there are parents and sometimes health workers who lack training who talk about wala namang lumabas. Bakit nyo ba binabantayan na may lalabas? No? Wala naman lumabas. There's no need to watch out for the worms coming out. Remember, the trichuris, the whipworm, and the hookworm are too small to be seen from afar. They are gasinulid. Unless, of course, you want to look at it close-up view. No, you might see it, gasinulid, but nobody likes that, okay? Side effects being blamed, again, this has to be addressed by risk communication. They're so afraid about worms passing out through the mouth. What is unusual about worms passing out through the mouth? Oh, pediatricians. I saw it in your pediatrics ward when I was a clerk and intern rotating in pediatrics. High-grade fever. Oh, the worms pass out through the mouth or pass out through the anus. A child who is about to die, parang nararamdaman niya na it's almost the end. Let's get out of this. Tapos sinisig, binigyan ng gamot, lumabas sa bibig. So in other words, it may or may not come out even without deworming tablets. Oh, this one, very difficult to deal with. I need help here. Bawal sa relihiyon. I don't want to mess around with bawal sa relihiyon. In some areas in Mindanao, children not dewormed because of cults. May kulto. I don't want to play around with cults. Okay? So that will be part of the 15 to 25% failure rate. Oh, ito na. This we can do something about pediatricians. May pedya kami, ayaw nila magpa-deworm, fine. And sabi ng pedya, wag daw magpa-deworm, hindi pa na-examine. Yun ang kawawa. No? The thing is, we need to be updated. This is now the new technology. Preventive chemotherapy, there is no need for diagnostic test. I also need help to explain why the child should not be dewormed when it is raining, or why a child need not be dewormed or should not be dewormed because it is full moon. I don't know the explanation. Okay, so let's talk about solutions. All right. Okay, I will go a little faster. Okay, our guidelines have been modified thanks to research and evidence provided by certain groups, among them the group that operates in the University of the Philippines, the group responsible for the war on worms, where data are now incorporated in national guidelines. It's even incorporated in the 4Ps, the conditional cash transfer of the DSWD, where deworming of the school children is required for that family to get the benefits now due. And of course, the DepEd has brought in the war on worms learnings as part of the essential healthcare program that partly explains why now the coverage rates in the schools are much higher than usual. Some outcomes. Methods of collecting epidemiological data in sentinel sites incorporated in the WHO manual called Helminth Control, a guide for managers of control programs. We have also validated a dose poll. A dose poll measures the height of school children that gives us the number of tablets of praziquantel needed for mass treatment, with praziquantel for schistosomiasis. Neglected tropical disease data are now incorporated in the Philippine Human Development Report. The economists are suddenly looking for neglected tropical disease data, realizing now that NTDs and development are intertwined. We have contributed quite a bit in terms of STH and schisto data in the Global Atlas of Helminth Infections. This PowerPoint is being given to you, I think, available in the website of the PIDSP. Please open the websites of GAHI, please open the website of the Human Development Network to get more information if you need it for your own personal use. One of the bonuses is that beginning last year, school deworming has been made to occur in just one day, where we aim to treat roughly about 15 to 16 million children nationwide. Simultaneous mass drug administration now occurs. The second round we had last January. We have harmonized the schedule of mass treatment for STH and schisto, where albendazole and praziquantel are given one shot, single dose, combined to target STH and schisto endemic areas. We have achieved 83% mass drug administration coverage last January 2016, and this is going to go on and on up to when? For as long as there are issues related to water, sanitation, and hygiene. There are continuing challenges, and we hope to be able to tackle some of these with people interested in the audience. We will need to take a look at Helminth control in other populations. For pediatricians, we're concerned about the PISAC. Remember the data in Masbate. Remember the data in some of the other areas I shared, where infection rates in preschool are still quite unacceptable. While it is easy to reach school-age children through DepEd in all public schools nationwide, there is a challenge reaching out to preschool-age children. You might say, what about daycare centers? Only 30% of preschool-age children are enrolled in daycare centers. And so catching these children for preventive chemotherapy remains as a challenge. We will need to interface very closely with water, sanitation, and hygiene sector. Health promotion and education risk communication is a must, no, tying up with health communication experts. And of course, the main research question now in the global community is, what does it take to finally eliminate STH? There are major challenges in terms of diagnostics. I'm sure that you've encountered situations when you have considered worm infections and diagnostic tests came back to you as negative. There are major issues that we have actually documented. Worm infections are normally diagnosed in this country by way of direct fecal smears, which examines the least amount of stool, no? And therefore, with very little stool specimen examined and a negative result, it actually does not rule out the presence of worm infections. In parasitology, the more specimen you examine, the greater chances of catching a true infection. Parang raffle. The more entries you send, the more chances of winning. And so we lobby for a minimum, and that is the Cato technique, which actually examines roughly 40 to 50 milligrams of stool. The wet smear examines a teeny-weeny 1 to 2 milligrams. And a negative result may actually not mean anything. There is a low sensitivity, there's limited sensitivity even of catocats. When the intensities of infection drop, the sensitivity drops to about 50, 60, 70%. And so you're missing still 1 out of 2 cases. Schisto is a challenge because Cato is not very good in catching schisto. Remember that the worms are not in the intestines. And in general, there is a lack of quality assurance for lab diagnostics, and so clinicians are challenged to make a good clinical diagnosis given the limitations in the lab diagnosis. Some opportunities: neglected tropical diseases and water, sanitation, hygiene are now included in the Sustainable Development Goals, and so expect bigger things as far as NTDs, worm infections, and WASH in the Philippines. NTD control contributes nicely to universal health care, which we espouse, which is our battle cry in the health sector in the Philippines. There is economic growth in the country, which we hope will continue, and much more in terms of resources for the Department of Health and the health sector to target the infectious diseases of poverty. And we will need to actually get into more intersectoral and interagency collaboration. This is now the moment to get rid of NTDs and worm infections finally in this country. In summary, are we winning the war on worms? I would say partially yes. Not totally yet. No, we will not claim complete victory, for the worms keep on coming back because of challenges related to water, sanitation, hygiene. Worm infections remain an important public health problem among Filipino children. Kindly share with the rest of your colleagues who are not here. Kindly share with your students, with your trainees, residents, and fellows, neglected tropical diseases. Now, this is now the subject of lots of discussions in the global community, global health community. PC stands for preventive chemotherapy. Sana lahat ng graduates sa med school naiintindihan yan, preventive chemotherapy. And of course, your usual water, sanitation, and hygiene. Please share the good news that there is new technology called preventive chemotherapy. While the outputs of war on worms has been disseminated and utilized as basis for policies aimed at improving worm control and public health, there are continuing challenges that need to be addressed using multidisciplinary intersectoral approach. Sustainable Development Goals, universal health care, kalusugang pangkalahatan, and economic development provide vast opportunities now in strengthening the national STH control program and other neglected tropical disease program. Our main research question now is what it takes for STH elimination, and let us move onward to finishing this war on worms. Thank you very much for your attention.